Going to be addressing a very major issue that has been a cause of concern for women within reproductive age, and this is the issue of contraception, especially amongst women who are sexually active. Every woman wants to be able to prevent pregnancy without having to visit the hospital or swallow some form of pills. It seems it is just practically impossible to prevent pregnancy without going through medical science. In today's video, I am going to be talking to you about natural ways through which you can prevent pregnancy. This is what we call NFP, natural family planning. I can guarantee you that as a woman, if you are very conversant with your body, you are calm enough and you are sensitive, it is very possible for you to prevent pregnancy, because the human body has a way of actually telling you if it is ready for conception or it is not ready for conception. So join me in today's video, and please ensure that you watch this video to the end, because towards the end of this video I am going to be telling you the category of women that are not suitable for natural family planning method. If I will be sincere with you, natural family planning method is not for every woman, but most women can actually use it. So watch this video to the end so you can know if you are able or you are eligible to go through this route. Let's jump right into it. So from the title and from my previous introduction, you know what we are talking about. So what are the ways through which a woman can prevent pregnancy? Number one is through abstinence. Yes, abstinence. I know you might be saying, oh, how is abstinence a family planning method for people that are sexually active? Yes. I said something earlier that for a woman to practice natural family planning method, the woman must be conversant with her body. Now, an ideal woman has a 28 between say 21 to 25 day cycle length. So once you know your cycle length, you should be able to track your ovulation, and on your fertile days you abstain from meeting your partner. If you don't understand what ovulation is, you don't know how to determine your cycle length, if it is 21, 25, 26, 27, 28 days, or you don't even know how to track your ovulation, there's a video I made up here that will tell you how to identify when you are ovulating, and there is another video I made on how to track ovulation. I will also try to link it up here and drop the link to the two videos in my description box, so you can watch those two videos after this video. Please don't go away, let's have this discussion. So how do you know? You have to actively track your ovulation. Know what your body is saying per time, know the changes that is happening within your body per time, and before you can decide or determine as a lady that, oh, this sign in my body is moving towards ovulation, or it means my ovulation is over, or you must have actively track and keep record. Yeah, this is track, actively track and keep record of your ovulation, of your cycle, of your body changes during your cycle for at least 30 days. That is, you have a place where you have tracked how your body works for the past 90 days. So when you have that and you have used ovulation test strip to determine when you are ovulating within those 3 cycles, then on the 4th cycle you can predict when you are ovulating. And also, when you are trying this method, ensure that you use ovulation test kits to find out if you are ovulating or not during when you are practicing this method. So for a woman, ideally within this 28 or 35 days, you have 7 days window that is unsafe. That is, if you meet your partner during those 7 days, the probability that you are going to get pregnant is higher. So within those 7 days window, you are advised to abstain completely from penetration. You understand what I'm saying now? The second way you can practice natural family planning, also going with using or calculating your ovulation days, is using withdrawal method. Now, withdrawal method simply means that the man would withdraw at the point of releasing, instead of releasing in the woman's uterus or inside her lady parts. This method has a lot of fail and a lot of successes. That will be sincere. It has not been guaranteed. In fact, it has been said that there is a 60% chance that the woman might eventually get pregnant. But for some, this method has worked. Now let's go to another method. Another method is what we call the barrier method. Now this barrier method is not 100% natural, because you have to introduce some things into it that are not just about the man and the woman, which is things like what I'm leaving the image here. I don't want to say it because they might ban my I don't want you to come for me. I made this video earlier and they took it down, but the video has been so helpful to a lot of women. I had to remake it in an appropriate way actually. So you can use this while meeting your partner to avoid pregnancy. There are some other things you can use. Some persons have used some form of spermicides that have been known to also prevent pregnancy. So during your fertile window, you use this or you use the spermicide. So those are the form of barrier method that you can use. So the final method I'm going to be talking to you about is the lactational amenorrhea method, LAM. What is LAM? LAM simply means exclusively breastfeeding, meaning that you have a newborn that you are breastfeeding exclusively. And what is exclusive breastfeeding? Exclusive breastfeeding means that during the day you breastfeed your baby at least every 4 hours, and at night you breastfeed your baby at least every 6 hours. That is what exclusive breastfeeding is about, meaning that your baby does not take any other thing aside from breast milk. That is what LAM is. And when a woman is practicing LAM or is exclusively breastfeeding, she does not ovulate. And when you don't ovulate, you don't get pregnant. So that is just the basic science behind it. So if you are not exclusively breastfeeding, you can't say you are practicing lactational amenorrhea. Also, this lactational amenorrhea has a duration. It cannot go beyond 6 months. By the time it is 6 months, then there is higher tendency that you can get pregnant. The reason why this method is last on my list is because the woman also does not have total control over this. Your body sometimes can, as it's moving towards the 6 months, it can begin to wane off. The effect of LAM can begin to reduce and you might suddenly ovulate. So since you don't know exactly when your ovulation is going to return when you are practicing LAM, then it becomes a major risk to use LAM as a form of contraception. I hope I'm clear. It is not as if it does not work, but you cannot track for how long it is going to be effective for you. So it increases the odds of getting pregnant. When done effectively, there are only 2 out of 100 women that uses LAM gets pregnant within or before 6 months. It is as effective as that. But the downside, like I said, is most women don't know when ovulation might return. Your ovulation might return earlier than 6 months. That is why I see some women get pregnant at when their baby is just 4 months old, some when their baby is just 5 months old. So when you are practicing LAM, I would advise that once it is over 3 months, 4 months, you can start looking at other forms of contraception, like introducing these that I said earlier into the bedroom. Having said all that, there are 3 categories of women that cannot use natural family planning method. 3 categories of women. Number 1, women with irregular period. You know, I said earlier that you have to be conversant with your body. You have to be able to track your body to know when you're ovulating. For women who have irregular period or who are not calm and sensitive enough to be able to monitor their body changes, they cannot use natural family planning method because they won't be able to tell when they are ovulating. The second category of women that cannot use NFP are women with multiple partners. When you have multiple partners, it becomes very difficult to come to terms with each of them on your method of contraception, because both man and woman have to be very active when practicing this form of contraception. So when you have multiple partners, it becomes difficult for all of them to agree at every cycle on your method. Another reason why women with multiple partners cannot use it is because this method does not prevent against infections that you get from jumping from one person to another, because it is not a barrier method and all. So using natural family planning method will not prevent getting an infection. That is why it is not recommended for them. The third women that it is not recommended for are women who are not exclusively breastfeeding. I mean, women who are not exclusively breastfeeding cannot practice lactational amenorrhea method. So if you are feeding your baby some form of food other than breast milk, you cannot practice lactational amenorrhea method. I hope that is clear enough. And also, if you are pumping the milk using pumps and all those new methods that women find comfortable now, then it would really not suffice for lactational amenorrhea. If you have also exceeded your 6 months of exclusive breastfeeding, then please don't go for lactational amenorrhea method. You have to stop it and look at other forms of natural or medical contraception. So that brings me to the end of today's video. I'm so glad that I was able to remake this video because a lot of women has benefited from it. So if this video is something that you like, I would really please implore you to give this video a thumbs up. Also, you can drop in the comment section any of these methods that you have tried and has worked for you. If this kind of video is something you like, or you are really interested in women's health for your own personal purpose or for the purpose of creating an awareness and educating others, please click on the subscribe button so that you can be a part of us. Then go ahead to click on notification bell, then you would be notified when we post new video. Thank you for watching today's video. See you some other time, and please take good care.